Welcome everybody to the Innovating Illinois Rural Health Event Series webinar. We will start in about 2 minutes. Okay, we're right at noon, so let's get started. Welcome everybody to the Innovating Illinois Rural Health Event Series webinar, this one is entitled The Award-Winning Model of Healthy Hillsborough, the Power of Rural Health, Community Partnerships, and Philanthropy. So we have today a wonderful panel of panelists, of course. I'd like to introduce you to our moderator, Brock Slaybaugh. Brock joined the National Rural Health Association in 2008. He is the National Rural Health Association's Chief Operating Officer. He was a rural hospital administrator for more than 21 years and has served on the board of the National Rural Health Association and the Regional Policy Board of the American Hospital Association. He specializes in rural health system development that encompasses population health and the varied payment programs, moving rural providers into value-based purchasing models. He's a member of the National Quality Forum's Measures Application Partnership, MAP, Rural Health Work Group, and serves as the board of directors of the Accreditation Commission for Healthcare. Brock is also the 2015 recipient of the Calico Quality Leadership Award of the National Rural Health Resource Center and received the American Society of Healthcare Pharmacists Board of Directors Award in 2018. Brock earned a master's of public health degree in health administration from the University of Oklahoma and is a fellow in the American College of Healthcare Executives. So thank you, everybody. Warm welcome to Brock, who is serving as our moderator. There are a few housekeeping items. We are recording this session for viewing on our website later. We are also, the chat box is open and we will be able to take questions there. So Brock, ready to start us off.
Well, thank you, Amanda, and welcome everyone to this call this afternoon or morning, depending where you are in the United States. I want to thank Southern Illinois University's Department of Population Science for hosting us today in this special event. I am always eager to talk about some good news that's going on in rural health. We seem to be focused consistently on everything that's bad, and I sometimes am called the prophet of doom and gloom when I come to speak at various places around the country. Today, though, is going to be quite different. I am absolutely thrilled to introduce the three panelists that's going to be taking us through the discussion today. And we will start with Dr. Nicole Summers Gabber. Summers Gabbers is the Director of Social Innovation and Assistant Professor for SIU Medicine Department of Population Science and Policy. Summers Gabber recently served on a technical expert panel for SAMHSA. And additionally, she is a PI of Healthy Hillsborough, which just received the 2022 Outstanding Rural Health Award Program from the National Rural Health Association. Her current work is divided between two tracks: mental health and hospitals, community health needs assessments. To support this work in the past 3 years, she obtained over $1 million in grants and contracts from places like Blue Cross and Blue Shield of Illinois, the Lumpkin Family Foundation, the Kidzeum of Springfield, Illinois, and local schools and local hospitals. Next is Rex Brown, MA, FACHE. He is president and CEO of the Hillsborough Area Hospital in Hillsboro, Illinois. During his time as CEO there, he has been a panelist and or presenter for the Studer Group, Studer Education, SIU Medicine, Department of Population Science and Policy, the Illinois Hospital Association, and the Illinois Critical Access Hospital Network. He currently serves on the board of the Illinois Critical Access Hospital Network. Last, but certainly not least, is Katie Kangemi, MA. She is the Senior Program Officer, Community Investment at Blue Cross and Blue Shield in Illinois. She leads community investment strategies and oversees grant making, sponsorships, and partnerships to improve health access and equity in divested communities throughout the state of Illinois. Blue Cross and Blue Shield of Illinois focuses on building strategic partnerships with nonprofit organizations to address relevant health issues and the social drivers of health to positively impact the health of our communities. It's my pleasure to welcome all three to our panel today. And to kick us off, I just wanted to say that we were pleased to present the Healthy Hillsborough program, the 2022 Outstanding Program of the Year from the National Rural Health Association. This facility and this project was awarded this honor at the annual conference, Rural Hospital Innovation Summit, that we hosted in Albuquerque, New Mexico in May of this year. I can say in talking with some of my staff in terms of processing the award, this one received some outstanding scores from our judges and couldn't have been more highly recommended to get this Outstanding Program of the Year award. Rural communities nationwide, however, have the important task of convening stakeholders to begin to look at how they can develop a common vision towards improving the health of a population. And I think that our program today is going to be illustrative of that very process, as to maybe encouraging facilities around the country to take control of their environment and to begin to move towards improving the health status of the population. I've long said, as a rural hospital administrator myself, and as somebody who has worked in the area of communities and community organizing, that rural hospitals need to become the convener in communities to address these issues of social drivers of health. As I said, NRHA is a membership organization. We have over 21,000 members nationwide. We compose a large number of the elements of what it takes to do rural health in our communities. For example, hospital and health systems, rural health clinics, federally qualified health centers, clinical services, and public health. Part of our mission, and a large part of our mission, is to recognize best practices where they exist, and perhaps more importantly, spread those best practices through forums such as this one. And that is why, as I said in the beginning of my introduction, I am really proud and pleased to be able to participate in this program today as truly a good news story for us to listen to in this hour. So, without any further introductions, we're going to start with a series of questions. So, this is going to be conversational. And I'm hoping that through this conversation, you all in the audience can join us. Please issue a chat in the chat box, and Amanda will be happy to get that to me so that we can begin to also include you all in the audience as a participant in this conversation. So my first question goes to Nicole. Nicole, can you give a summary of the Healthy Hillsborough project, and how did it come about, and what kind of work have you done in Hillsborough?
Sure. So this project started when Hillsborough Area Hospital came to us saying that they wanted to address youth suicide in the community. At the time, they said that they wanted to target bullying in the community because they had heard reports that that was the reason behind the suicide ideation increase. And I really encouraged them to dig deeper and make sure that bullying was the biggest factor attributing to the issues before actually investing into programming. So we went in and we surveyed all the kids in 6th to 12th grade in Hillsborough on their mental health and risk and protective factors that could contribute to poor mental health outcomes as well as other health issues. At the same time, we had worked with the hospital and the school district to start to create a coalition. And this coalition included youth, it included parents, it included key stakeholders to eventually review that data and then choose what path was the best for their community. And what we found was actually that 1 in 5 kids considered suicide in the past 12 months, and around 1 in 3 youth had between moderate to very severe depression. We then looked at why this was happening, and we found out that while yes, bullying was a significant risk factor contributing to poor mental health, we also found that low school commitment and family conflict were just as influential, if not more so. At the same time, the biggest protective factors were things like pro-social development or rewards for pro-social development in the school. And then we took all of this data and we presented it to the coalition. And after searching through a lot of resources like blueprints for healthy youth development, we identified and recommended some evidence-based programs to target those risk factors and then leverage the protective factors. The coalition then voted on which programs they wanted, and the hospital was actually the one that, supported them all along the way and invested into those programs. And the first program we implemented was Sources of Strength, and this was right in the heart of 2020. So despite everything that was going on, we found a way to still continue. I mean, it was needed more then than ever. And that data had been collected in 2019 in around November. And so there was just, higher need even more so with everything that had been going on. And Sources of Strength was a school-based program. It's a universal prevention program, which can also be referred to as a tier 1. And then we went in and implemented, following up with something called the Blues program, which is a selective intervention program, also referred to as a tier 2. And now we've actually expanded efforts to start include family-based programming. And we've started to turn to other neighboring communities to see how we can use a similar approach to address mental health.
Well, that's really an outstanding overview of the project that you did there. So I assume then, Rex, how did you even think to reach out to SIU and the Population Health Science Department to assist you in really a complicated problem?
Well, it's pretty easy. A short answer is we'd worked with them before. They had approached us on a different project in 2013-14 related to colorectal cancer screening grant that they were looking for support. So it was a really unsolicited letter that came to us, and asked if we would write a letter in support of that, because we were in a county that did have a hot spot. And we started thinking, what if? So we were, what if we help sponsor this? What if we supported the grant? What if? And that just went on. You might think of that as looking outside of the box, but we saw it as an opportunity. And when I say we, I'm talking about, you know, board members, and we have 4 corporations, or we're unaligned with any major system, of course, was just us. And so from there, that failed. And we promised to keep in touch. And so we had a problem, and they had a solution. Just before that, however, they had come to us with a proposal on baby brain development. The first thing that I said is, we're going to have to change that name. And so that became Little Leaps. And there's research that was being done in New York City and Baltimore inner cities. And the school wanted to see if there was an impact on neurosynapse development in rural areas, caught our attention. And then we ran a project for 3 years together with the great outcomes. So we knew each other. That team, much of that team has moved on. But then we had a concern from the board and our physicians, who said that the children don't act the same way that they used to. And many of our physicians are from Hillsborough. And so they knew the difference between when they were in school and now. And so first phone call was to the Director of Population Science and Policy, Dr. Samir Bora. That was my first call the next morning after that board meeting. Who else? We'd worked with children. We knew the staff. We had a lot of confidence in them. And we needed help because I was clueless. Often am, frankly, so that don't be surprised. But that's how it happened. There was a need. We had the experience, great relationship, and from phone call, Dr. Vora put together a team, and the solution was perfect. We wanted to do research. We didn't want to guess with the children's lives. We weren't going to do it. And so we wanted numbers. We wanted it measurable. And along comes Nicole. And she added a new dimension to it. And she used the word coalition. And I did not know how we were going to pull this together. And so it was not clear to me what our role would be. And she was able to coach us through to a perfect situation where we could be a resource, but we were not the decision maker, which really expanded the breadth of input, support, and our ability to move quickly, even though, as Nicole said, we got hit by COVID. We didn't miss a beat. We were able to keep going. If it had just been the hospital and we had done things in the normal way, wouldn't have happened. So again, it was very simple, made a phone call, and then the work began.
Fascinating. So you started off with colorectal screening. You did the suicide assessment and prevention, and then also the Little Leaps, which is childhood development. Did you have any sense of a community health needs assessment? How did you discover these needs? Like, did they just come to you through the community involvement, or was there some scientific method in which, you know, you collected data around a CHNA?
Oh, great question. We have a lot of programs that we're engaged in related to, I'll call it health and healthier Hillsborough. And a lot of that comes straight out of the community health needs assessment. One of them, I'd like to go through that list. quickly at some point in time, so you get a sense of how engaged we are. But one of them is the most recent CHINA that we did, identified, food insufficiency. And we'd already been addressing it. We amped it up. So amping it up came out of that study, and it's one of our strategies now. And we're going to connect with a hospital not too far from us. That facilitation took place under the guidance of the Department of Population Science and Policy. So Nicole facilitated 3 hospitals pulling together a CHINA so that we could have more power with the limited resources that we have. So we have a food program, summer food program for youth. We like to combine it with assets that we have. And along the way, we were able to have a fitness facility developed. It was a $5 million project. And we try to use that as often as possible under healthier Hillsborough, especially what we can do with our youth. So we had lunch and exercise and intentional activities. Of course, the pool was often involved. There's a gym, so we had things that we could do. But we had another factor, and that was we wanted children who were not getting lunches at home during the summer. They can access food during the school year, but the summer was the area of deficit. We wanted them around adults that we thought were high caliber. And so we had volunteers, and wasn't hard to find volunteers to have food with children. So we had a great group of volunteers, and they were models and role models. And we would encourage our hospital staff to take lunch when the youth were here having their lunches. And indeed, bonding just took place, and they got to see people that work and are responsible and are doing well in life as adults. And hopefully that made an impression. So that was a program that came out of the CHINA.
So kind of a blocking and tackling question, and I'll start with you, Nicole, and then Rex can follow up. How do you go about assessing stakeholders that you would engage in a project? There was obviously, we've had 4 listed really good topics for a rural community to address in terms of population health. What are some of the factors that you go through in terms of assessing that part of this work?
Would you like me to go, Rex?
Yeah, I'm sorry. I thought it was your question.
Nicole and then Rex. So Rex, yeah.
Okay. Yeah, thanks.
Really, first you have to think about what the area of interest is you're targeting. So if it's mental health, youth mental health, well, you have to have youth involved, right? And you have to have their parents involved because they might have to give consent for some kind of program that they're involved in later. Then you have to think, well, where are your services going to take place? Where are your strongest assets? In Hillsborough, the strongest asset is really the school district and the hospital. In other communities, it can be something completely different. It could be the health department, or it could be a juvenile justice system. Every community is a little bit different. So what are your strongest assets? And then try and diversify those a little bit. So can you get somebody from local businesses there? Do you have people from different areas of expertise that they can contribute to that success? So do you have somebody who's comfortable, let's say, with writing or with design? Because then you can create communication around that and distribute information about what's going to go happen in the community. And I think the best way to identify those people is once you form 1 or 2 relationships with individuals in the community, such as a superintendent at a school district, you ask them for referrals. And then that's when you approach people. You want the community to elect those individuals. I don't think as an outsider, because I am an outsider to Hillsborough, it's appropriate for me to, identify who I think is best. It really needs to come with who they value, who they look to for leadership, and also who maybe isn't a leader yet, but has great potential to be one in their community.
Yeah. Rex, any follow-up to that? Great
Well,
insight.
yeah, a little. Nicole's right. You want to expand beyond who you know. But at the same time, if you're highly engaged in your community, you know a lot of people. And we have been highly engaged in a broad way. So we have board members, all told, I'd say we have 30 some board members on the 4 corporations. We have volunteers. We have so many projects that we've worked on in the community that we know what people, who people are that are successful within that niche that we were, doing things together and partnering. By the way, our vision statement does says we will partner with our community, and that word partner is a little nuanced from collaboration. It really, that partnering can be extended. So when we do go out, we kind of know who to ask to say, who would you put on a committee with this responsibility? So we've got a high degree of success doing what Nicole had suggested is you don't, just ask the people that you've always asked. And that has truly been remarkable. I'm going to give an example real quick. We wanted to, we leased our ambulance garage to a company that was going to start a computer software program. And we needed coders. And we thought the company would stay in the area for quite a while. So we needed to teach kids how to code. We didn't have any of that going on in our schools. And this is maybe 7 years ago or so. I didn't know anybody who coded. And by connecting into that group, we were able to put together classes and weekends together and end up with a group that said you've got to have fiber. And we were able to coalesce a group and petition signing, and we were able to get fiber for our community. People I didn't know and never knew them. And some of them worked in an hour away in St. Louis, for example, for Boeing. And so they high level of expertise, but we'd never crossed. So got to ask other people you don't know.
It's amazing the power of relationships and how those can, really start to amplify the resources that you have under your nose but didn't know it. And I think that's really an extremely valuable part of a process like this. And so, Rex, obviously this has impacted people outside of the hospital, the relationships that you've built, the connections through these projects that really can't be replicated or maintained any other way. What has been the impact in terms of your thinking about its expense to the hospital? I know there's a lot of rural hospitals out there. 45% are losing money on operations, faced with some inflation like we have going right now in the economy. What's the impact financially on your facility, and how have you managed that? I mean, I think that's an important part to a conversation like this.
When we started, we were poor. When we started doing this, I mean, we were really poor. So no excuses on how much money you have. Won't accept it. Don't let that stop you.
Thank you.
As you go out, you'll find money. And we did. And things just happen that you never, unintended consequences, but they're positive. So we found money started coming our way. Our operations got better. Attitudes got better. Support in the community got better. Continued to increase. And I don't want to say that philanthropy did it all, but you have your own ability to have income, you have grants, and you have philanthropy. And those are kind of 3 legs of the stool that I learned, back in graduate school 50 years ago. So we did have philanthropy. And it came from unusual places. There was a individual who had been a physician. He died 30 years before I got here. And there was a will, and it worked perfectly for a program that we wanted to put together. It was a franchised program called Catch Kids. You catch kids who are at risk for becoming obese. Structured program, evidence-based. It's after school. You have homework, you have exercise, you have healthy snacks, you have nutrition teaching, and the family gets involved in that. And that money was able to go to that program. And I don't know, it's probably funded for 15 years, maybe more. So it didn't cost us anything. We got involved in it, and boom, it was paid for. Now, that's a great story. It's true, but it's a great story. It wasn't all that easy necessarily for it to happen, but in the end, you look back and it was well worth it. With the mental health, we had never raised funds for that. We had a delightful, wonderful guy who was the chairman of the board. He wasn't from the community, but we raised money on his name, and he had passed away, but he had tried to commit suicide twice. And so it was close to him, and we were able to take that with the permission of his family and the David A. Imler Youth Assessment Project came into play, and we raised the money to take care of the cost of having the program. So strengthening families and blues and sources of strength, and so those three. And we have money to go to the next school system east of us, about 20 miles, and we're able to handle the programs that they have. Now, the hospital, because we're doing a lot better than we were 25 years ago, we're able to afford the research. And so the research, again, is imperative. We're not going to, we really had a big question. Do you think it's the same in that community, the same problems as we have here? And so it's like, wow, we wouldn't have to do research if it turns out that all of our communities had the same problem, because we're going to continue to move through into different school systems if they're so inclined. And it turns out they have different risk factors, different support factors. So the doing the research and not guessing, I think is really paying off. So the money, I don't want to say it's like magic, but as you're talking to people, and if they put things in their wills, or if they donate money, and then grants, we just had a tremendous grant, and that one was for $300,000 to support what we are calling the third leg, which is of our mental health impact, which is strengthening families, and that's starting this fall. So we were going to figure out how to run it as we went along, and the money came.
Wonderful.
Yeah. I hate to say it that way. I once heard Oprah Winfrey talk, and just as an aside, yeah, I was in her limo, and I went and I got her dinner and fed her, but different story, different time. But she got up and she talked about these things that happened to her, and I'm thinking, oh, that's easy, to look back on it and say, oh yeah, these numbers, or I touched leaves, or the types of things that Oprah does. She's very sensitive. Yeah. No, it really does kind of happen that way.
That's awesome. And thanks,
Yeah,
Rex. And
it is.
I think it's encouraging to everyone to understand that you can start someplace, and the financial factors are obviously there, but they are not determinate in terms of your approach to solving problems at a local level. And this kind of, in a funding sense, brings us into the a funder that we have on the line, and that's Katie. Katie, can you tell us how you and Blue Cross and Blue Shield got involved in this Healthy Hillsborough project?
Yes, happy to do so. And a pleasure to be here with all of you today and hear this great news and catch up on all the great things that are happening in Hillsborough. We are just really pleased at Blue Cross Blue Shield of Illinois to be part of this in a small way. I'm coming to you live from Chicago, and SIU has been our go-to partner for a few years now. We, as you discussed at the top of this, Brock, we are at Blue Cross Blue Shield on the community affairs side interested in health access and health equity, and really looking at that constellation of the social determinants of health. We have long known, I think all of us know this intuitively, that health conditions show up in the body the same as if you are in, Southern Illinois, as if you're in Northern Illinois. However, your access to care probably looks really different depending on where you live, if you live in a densely populated area or a more rural setting. And so we knew that in order to really understand the health opportunities and the challenges, it was really, really important to find a partner located in the areas that we're interested in. SIU has just done a tremendous job of showing up not only as an institution of knowledge, but this convener and on the ground partner that knows how to reach out and find out who is working locally, who has, their eyes on the ground and knowing what's going on, because it really is important to understand the community context. And each community is very different. And it would do absolutely no good and wouldn't even work if you had an entity sort of helicopter in and say, this worked over here, therefore it's going to work here as well. That absolutely doesn't work. And so understanding that SIU is working with myriad partners who were taking a community strengths approach to investigating health conditions and finding out what was really meaningful and important to the people that were there locally was very attractive to us. And so talking with SIU, finding out who the partners were, and then also asking questions about these different health conditions and the social determinants of health that were influencing them, either helping promote better health access or creating challenges. And so again, not only not coming up with a prescribed model that would work, but also saying, let's make sure we fully understand what's going on. And as the world heaved and continues to shift, as we, hopefully move from a pandemic into healthier times, being hit with COVID, understanding that that was also going to dramatically affect the way in which people were accessing care, especially behavioral health services, was really important. So SIU coming forward saying, hey, we've been working with this constellation of partners, really was attractive to us. And we felt confident that that group coming together was a way to figure out what was most needed and some really creative and strength-based solutions that would work.
Well, thank you, Katie. And I think it's important to recognize and give credit to Blue Cross and Blue Shield for noting the value of rural health care and the sensitivity that you're taking to communities in the developing the solutions that they have individually to solve. And so I think that's really very important. So thank you so much for doing that. And kind of following up on that, then recognizing the value and the intrinsic nature of problems that are found in rural communities. How did you decide at Blue Cross and Blue Shield to fund this Healthy Hillsborough project to the extent that you did?
Again, this sort of fits within a larger partnership with SIU. And so we've partnered with SIU to say, hey, we are following your lead. And as you continue to work with your partners and your partners say, this is what is important, then we trust you to make the determination to continue to grow those programs. That is something that, when we think about not only the program design, the approach, but also what are the outcomes that are best suited for that area. We rely on our partners to make those determinations. We see, who is there locally as the expert in that area. And so SIU just following their lead and saying, hey, this is where we know that there is great opportunity and that there are people at the helm that are listening in thoughtful ways to come up with the solutions made sense to us.
Very good. Thank you, Katie. We have some questions in the chat. One question, and I'll just throw it out to maybe start with you, Nicole, and then is, do you have plans to engage environmental health stakeholders? CDC Health Communities has good resources to foster the engagement.
I would say at this time, I don't have direct plans to engage environmental stakeholders, but I do find a lot of value in it depending on what you target. So if you're working to address housing as an issue, water safety, nutrition, I could see that as being a crucial component for engagement. For mental health, I haven't seen the overlap yet, but I'm open to anything if we find the right partner, and if somebody has some recommendations and is willing to send them, I'm more than excited to investigate them, because we can always do better. And if there's any ways to improve, I'm always open to it.
And I guess that you may have answered that, but the follow-up question is the licensed environmental health practitioner. Do you have plans at the health does your health department have an LEHP? And I guess I'll throw that out to Nicole and Rex, if you know.
I don't know. I've not heard of that. And we've already interested me because we certainly have water resources here that are, I have to be very careful here, but could be affected by a coal mine and could be affected by runoff or having silting issues. So just on the water alone. On housing, we are aware of many of our issues there, and we set up a community development corporation, which is approved under the Federal Reserve, so that as long as you're willing to risk your money, you can loan it out. And we've done that to the hospital's the major investor, but we've done that so that we can build homes. So it's slow for us. We're not having tracts of property available, but we can also help businesses sustain themselves and fix up storefronts and add people, things like that. So housing, yep. Water, yep.
Well, very good. Thank you, Rex. Looks like thank you all for, and I'll remind you that there is the ability to enter a chat question into the function here on your screen. So if you have a question that you would like to pose to one of our or all of our panelists, please feel free to do that. Why does this model make sense in a rural community? And I mean, I think obviously I know the answer, but I want to start with Nicole and then Rex to talk a little bit about why it makes sense in a rural community generally, and looking at it kind of on my conversation a second ago regarding finances, the return on investment. And that term is a little bit misleading, I think, in this case, but I get what they're talking about in terms of, is the effort going to pay off in something tangible? So Nicole and then Rex, if you wouldn't mind maybe taking a stab at that answer.
Sure. I think one of the most challenging things for people to understand when they hear of Healthy Hillsborough is there's just so many different areas that health has been targeted, so many different age groups that have been targeted. And rather thinking about, the solutions that were chosen to address those issues, like the mental health programs, for instance, I think it's more important to think about the process that's behind it. And the process is what you can transfer from one community to another. Being able to go in and do a deep dive investigation into what the real issues are and hearing from as many people from the community as possible. And then letting them, not letting them, that's not the best word choice, but giving them a platform to make the decisions that of things that they want to see happen in their community, and having their buy-in and their involvement and their leadership and making that sort of thing possible. All of these aspects are really important, especially to rural communities. You don't want to take a program of something that has been tested in Chicago and New York and St. Louis and just assume it's going to work out in Hillsborough, Illinois. It's a completely different environment, a completely different infrastructure. And you want to make sure that it's a program that the community actually accepts, because what might be acceptable in Hillsborough might not be acceptable in Chicago and vice versa. And so having that buy-in and making sure that people, have some kind of ownership in what's going to happen is what's really, really important to rural communities, because that means that it's a targeted approach just to them. It's not something that's cookie cutter. It involves them from start to finish, and without their involvement, it wouldn't get off the ground, and there's no way it would have hope to be sustainable.
Thank you, Nicole. Rex, any thoughts on that question?
Well, I look at the model differently, let's say a little differently from maybe a provider standpoint, but the old phrase is, for business is find a need and fill it. Well, who do you go to find the need is one question. And and then the next one, so what if we do, how would we go from one point to another? And that's the fill it part. And we didn't have a lot of expertise when we started doing this, and things have just happened. As I've talked about, the Western Illinois University runs an incredible community mapping, I think they call it. They came here and it really expanded people's engagement. It kind of like took out a layer of leadership. It said you can't come to our meetings, and people that never had a chance before got involved, and it was just exceptional what has happened through that process for us. So that gives us, an opportunity to tap into that as we find ways to address things. So our process comes from, experts, and that's not us. We're the listeners, and of course, the School of Medicine is a major source of that expertise. I advise that sort of relationship for all rural hospitals. Get out there. You might not feel like they know who you are, where you are, and you're right. And so you have to take the initiative. Don't wait for a letter to come asking for a letter of support like we did. And when it happened, it's like, who are they? And from there, we start saying, well, what if, as I shared earlier, and look at what happened.
That's a great point, Rex. And I think that what I would say in response to the question, and getting the tools that you need to be able to implement this process. And you can go online and find a number of resources that help you in convening groups towards solving intractable problems regarding population and their health in rural communities. But having resources like Nicole and the team there at SIU could really be helpful in terms of taking you through at least the first couple of times the process of developing the strategies for solution. And and then when you build on the success, when you get to that moment when you've seen that you've accomplished something, that gives you all the confidence in the world then to go to that next project, that next step, engaging different stakeholders, et cetera. So I think that for me is just an incredibly powerful, and everyone, it's really nice to have that resource there in Illinois. In the few minutes that we have left, I think that I wanted to focus now on what does this effort look like going forward? Because I think obviously you've had some remarkable success in your past. Maybe the most important thing now is to hear a little bit about the future. What do you hope? What's your vision you're looking forward to in this project? I'm going to start with Rex and then Nicole and then follow up with Katie.
Oh, thank you. Today I had a phone call, and what with the whole mental health, it really started with a child development center that we have a 3-member partnership. Back in 2003, we started to pull this together. It's been wildly successful. So we work with children 6 weeks to 5 years, and it's not childcare. That's a component. It's child development, and that's where we put the Little Leaps program, by the way. So we keep moving back in the age that we know we have to engage with in order to address our mental health issues. So we started with high school. And it was apparent to all of us, but they got there with something. Can't you move it further back? But it was what we could do at the time. Then it was middle school. And now what we're looking at is mental health within a model being our child development center. What can we do from 6 weeks to 5 years? Because I think that's where we can get our strengthening families to get engaged. We're having, like I said earlier, we're going to start in the fall, but getting people involved in it and committing one night a week to strengthening the family. How do you do that? And so it's getting traction. And so when you get traction, doesn't matter if you're going uphill or not. Traction is getting you somewhere. So the traction really started today. We're going to meet with the school superintendent, and we're in the middle of our master facility plan. I know we're going to have to build space. So we'd want to do it to accommodate, well, what is mental health with young? What would we do? What does space have to look like? But also, there's an early childhood development center concept. And for some unknown reason, and I did not know it until today, there's been an explosion of issues with children in our area that are having childhood development issues. So it's triple what it was 3 years ago, that sort of thing. So now it's got my attention, and that's way outside of what I ever would have expected, but it came on a mental health call as to how can we do something. And then, oh, you know, there's a problem over here. Did not. So what's our future? We're going to start investigating that. I had the ability to share just slight ideas with the board recently related to how we can expand the child development concept that we have, but I hadn't told them what I learned today. So I'm addicted and I can't wait to get this started somehow. So Nicole, strap yourself in. I think we're going in a new direction. It's just further in a direction.
Thank you, Rex. I think you have your next work plan set up for you, Nicole. So So what do you have going next for you? What do you think, where does this effort look like? What does this effort look like going forward?
Well, Rex always has big plans, but I think for the first time, my plans are a little bit bigger than his. And I'll say
Oh,
that Hillsborough will always have a place in my heart going through this process. It's just been so magical how many challenges, the world has seen in the past few years, and they have just blown through with flying colors and so much positivity and so much strength. And I would love to see that brought to other communities. At SIU, we service 66 counties in our region, about 70% of which are considered non-metro or rural. And I would like to see this kind of thing be brought to other communities, but it's not easy. I mean, minimum, it takes 2 years to do this kind of process. So I've been working on ways to streamline it. We've already started to test this in Nokomis with the same way that we did it with Hillsborough. We've collected the data in the fall and we're working on program selection right now. We have a coalition that's built. But then I'm trying some shortened versions in Alton, Illinois, and in Mount Olive, Illinois, that will be starting up in the fall, and we'll see how those work out and if we can be successful in the same degree that we have been with Hillsborough. I'll say that there's already been a lot of lessons that have been learned. Even if two communities are in the same county, they can be completely different from each other in every way. And ideally, I would love to see, other communities be able to get on board with this type of process and be able to help their youth, to help their families as much as possible, regardless of, the amount of resources that they have.
thank you, Nicole. It's very ambitious and it's really great to hear. We'll look forward to a webinar in a year or two to see the progress towards those goals. That's really exciting. And last but not least, Katie, where do you see this headed going forward?
We're really excited about what has produced so far. And I think just hearing from both Rex and Nicole that there is an ongoing path that is being informed by what they have learned so far and opportunities to continue to serve and improve health services, especially mental health services. I think one aspect of the pandemic that has been positive, there have been many, dare I say, that's hopeful thinking, is this attention to the importance of behavioral health and just really appreciating both Nicole and Rex paying attention to the little guys and ensuring that we're considering children in this equation. The considering whole health as including our minds as well as the rest of our bodies is essential. And so understanding that this is not going away, but that rather that there are continued opportunities to improve the way in which people access mental health care. And so I'm really excited to hear that what has been happening in Hillsborough has been so positive, and also hearing from Nicole that there are plans to consider this in other communities where you can take the learnings and perhaps create some efficiencies, but then also recognizing that those communities are unique to themselves as well. So just really looking forward to what is learned in Hillsborough as well as other communities in Southern Illinois.
Well, thank you, Katie. And this is wrapping up the hour that we had together today. And I want to thank our panelists for joining us for this important conversation, telling some good news. Rural providers have been experiencing drivers of change that are moving them into value-based purchasing arrangements. CMS has made announcements that by 2030, they want every provider in the United States participating in some kind of accountable care organization. So these are pressures that are creating needs for rural providers and communities to think differently about how they provide care. But a rural hospital can't solve any of these multifocal complex problems by themselves. And so they need a convening of stakeholders, around a mutually identified mission and vision for increasing the health status of a population, all while keeping in mind leveraging scarce resources that we have within our rural areas. And I also want to mention it, Katie mentioned it, and I think it's really important that I think that this notion of convening stakeholders in a community can advance health equity by including the representation of voices in our community that have long been overlooked in our past. And I think bringing them to the table to express their needs and concerns are very important. As Aristotle said, the whole is greater than the sum of its parts. And I guess my challenge for the audience today as we leave this conversation is, what will you do to convene, to bring change to your community in the future? So with that, I will see if there are any instructions from Amanda before we sign off. I'm not hearing any. Oh, hi,
Thanks,
Amanda.
Brock. No, I just have I'm just gonna throw up a PowerPoint that includes instructions for your continuing education. As promised, this was recorded today and will be put on our website. So that's www.siumed.edu/pop-sci, SCI policy under Rural Health Summit. If you give us a couple of days, it'll be up there as soon as we can get it up there. Thank you everyone for attending today, and thank you to our panelists for a very great webinar.
Bye, everyone.
Where to do that?